Good morning. Today I am going to perform a platelet-rich stroma procedure into the left knee of a 73-year-old patient. This patient has been suffering from knee arthritis for a long time. This X-ray was done in 2022, and then she subsequently, I think a year back in 2022, because of the unbearable pain, she went and got her right total knee replacement done in another hospital. She is not entirely happy with the procedure. Right from the hospitalization, she remembers everything traumatic about the hospitalization and the procedure. To begin with, her experience in the ward was not good because she was administered medicines. She must have been administered medicines for post-operative pain relief, antibiotics and all that. She tells me that the nurses used to prick her veins several times to give injections. So obviously there was no proper pain control system at that time. In my practice, my anesthetist keeps an indwelling catheter into the epidural space for 48 hours and patients experience no pain. So this lady had experienced post-operative pain also, and the physiotherapy also was prolonged and painful. Therefore, she was put off by the experience of a right total knee replacement, and this time she wanted to have a less traumatic and easy procedure. I have explained to her the benefit of a total knee replacement, and I assured her that her experience will not be traumatic. Yet in spite of that, she was convinced that she didn't want a total knee replacement on the left side, and she deliberately chose a PRS, that is a platelet-rich stroma procedure for the left knee. So I'm going to show you the X-ray of this patient here. These are the X-rays of the patient. These are dated June 2022. Right knee, left knee. When this X-ray was taken, she did not have the right knee replacement done. Subsequent to this date, she has undergone a knee replacement on the right side. And today I have performed a PRS procedure on the left side. You can see on these X-rays that the medial joint space is totally narrowed on both sides, and the lateral joint space is opened up. There is some subluxation or moving out of the tibia. Same finding on the left side also. The joint space between the patella and the femur bone, that is between the kneecap and the thigh bone, is narrowed. So she has got arthritis in the front compartment, inner compartment, front compartment and inner compartment of both the knees. She has undergone a knee replacement on the right side, and today I have performed a platelet-rich stroma procedure on the left side. She is a right candidate for total knee replacement, but in case a total knee replacement is not advised, PRS procedure can be done, and I have done that procedure today. She has felt relieved. So the point is that even though this is a grade of grade 4 osteoarthritis in the left knee, right knee has been operated already, TKR has been done. On the left knee, although she has severe arthritis, I have done the SVF procedure today, and you will be seeing the result in another video. So just watch out for that video about the outcome of platelet-rich stroma procedure for a case of severe osteoarthritis in a 73-year-old patient. There is also a video on how I used ultrasound to inject the PRS into the knee joint, and you can see that video linked up here. PRS procedure, platelet-rich stroma procedure, can be done even in severe cases of osteoarthritis. The results are good. In an academic paper, it has been found out that PRS or SVF treatment performed better than all the other injections for osteoarthritis, including hyaluronic acid, PRP, bone marrow, etc. So SVF or PRS containing SVF was the best biological solution. We have performed that today. Let's await the result. I will show you the immediate result in a testimonial with the patient. You can watch that video here, which will be coming later. Hope this video inspires you. It gives you more confidence in this procedure, that is the stromal vascular fraction. combined with PRP, which then goes on to make PRS solution. If you found this video helpful, kindly refer it to a friend or relative who is suffering from knee arthritis and is contemplating a knee replacement. They will definitely find this video helpful. Like this video. If you want to watch more videos like this and you want to see more patient stories, then I suggest that you subscribe to my channel Madras Joint Replacement Center MJRC and press the bell icon to receive all notifications. I will see you in another video. Bye.